Lindell, Public and Media Relations for Mission Health, and I'm here today with Dr. William Hathaway, who is our Chief Medical Officer for Mission Health in the North Carolina Division of HCA Healthcare, and we're here to provide a COVID update for the community.
Well, thanks, Nancy. It's good to be here again. It's been a couple weeks since we've provided an update. What impresses me most now as I look back at what's happened in the course of the last number of months is that we are now 3 months plus into this for our health system. We identified our first patient in our hospital on March 20th, and here we are going into the July 4th holiday weekend, and so much has happened since that time. What most recently has struck me as being interesting or concerning is the recent resurgence or rise in cases, particularly in other parts of the country, but also here a bit locally. I think most of us have seen on the news that states like Florida and Texas and Arizona in particular, but not exclusively, other states also, have seen a very significant increase in the number of positive tests. And just recently, Dr. Fauci said that, and I completely agree with him, that it's not unrealistic to think that we could see as many as 100,000 new cases a day. The good news for us here locally in Western North Carolina is that while we have seen an increase in the number of cases recently, most of them have occurred in the outpatient setting, meaning that it hasn't affected our hospitalization rate. We have seen early on, we were in the 2 to 6 range. We had a bump up in May to about 10 to 12, 14 patients a day, and more recently we've been running right around 20 patients a day in the hospital. But that number has been flat. That's good news, but it isn't completely reassuring in the sense that we are not immune from going up to a surge like they've seen in other parts of the country.
And when we're looking at the testing, how is that affecting these numbers? I mean, I've read or seen people talking about how the numerous testing is what's bringing these numbers up.
Yeah, it's really important to understand 2 things. One, if we tested more people, we could see a higher number, absolute number of cases. So we don't simply look at the numbers of cases, we look at the percent of tests which are positive. And if we were testing more people and picking up a few more cases, we would expect the overall percent of cases who are positive to drop, and that's not what we've seen. We've seen in North Carolina about a 9 to 10% positivity rate, and that's been pretty flat. In Western North Carolina, it's been a little bit lower. It's been about 3 to 4%, depending upon what county you're in. But that number has been constant. And so when we're picking up more cases, it's not a result of more testing alone. It's the result of actually having a real increase in the number of cases. And that should concern all of us.
And we look at testing at the hospital, kind of walk us through that. A person wouldn't come in and just be tested. We would test somebody at the hospital who has symptoms, who appears to be sick, who we feel needs to have a test. Yeah. And in those cases, still only a little over 3% of those tested are positive.
That's correct for the most part. One of the things that we have learned in the course of trying to manage the pandemic across the country is that our ability to do so depends on a lot of different things. Most importantly, just practicing good social distancing, wearing a mask, waiting 6 feet apart, washing your hands. That'll never change. That's critically important. But we've also learned that testing and widespread availability of testing helps us to identify where the outbreaks are so that we can do contact tracing and try to control those outbreaks and prevent the spread. The guidelines have changed over time. Early on, we weren't testing people with mild cases because we didn't have the tests. The test reagents are becoming much more widely and readily available, both nationally and locally. Still not where we need them, but much more available. And Buncombe County has now reinstituted their testing sites for people who just feel they need to be tested. At Mission, because we have patients who present to us who are sick who need testing, we have patients who present to us for procedures who need preoperative testing. We are not able just to test anybody who wants to be tested. In an ideal world, that might be something we'd like to do. There are certainly pros and cons to that, but right now it's selectively based on clinical indications, which involve both symptoms and the need for additional testing or procedures.
And of the cases that we've had here, we've had some serious cases. We've unfortunately had a number of deaths from this illness. I think sometimes people believe that that only happens to people who are older, in their 80s, and they're the ones passing away from this. True or not?
Well, yeah, it's not true. It is true that the vast majority of the patients who get seriously ill and sick and die are older. 80% of our cases of deaths are in the age group above 50, and the vast majority of those are above 65 in age. But at Mission, as an example, I looked at the numbers yesterday, we have had 18 deaths at Mission Hospital, and 6 of those occurred in people below the age of 50. So it's while you are safer, no one is safe. And it's critically important to realize that not only should you protect yourself by minimizing your exposure to the virus by wearing a mask and practicing the good hygiene measures, but you should also be aware of the fact that those practices protect other people and that we have an obligation to prevent the spread to others. You may not interact with anyone who lives in a nursing home, but what if you're out somewhere and you interact with someone who does work in a nursing home and you've inadvertently, asymptomatically given them the illness? And so that's why we really want to emphasize, I can't say it enough, to wear a mask, wash your hands, wait 6 feet apart, do those things. Don't go out in high density social situations recklessly without taking care of yourself. Only do what you absolutely need to do. That's our number one method of controlling the spread of the pandemic at this point in time.
So we could sort of say that if you're the sort of gentleman who would hold the door or tip your hat or say please and thank you, you're the sort of gentleman that would wear a mask.
It's kindness, it's respect, it's thoughtfulness for people we don't even know, for friends, families, and people we don't even know.
And recently, this past week, we've changed our visitation policy. Can you talk to us a little bit about what that means for our community?
Yes, I can, and I'm happy to do so. Early on, before we had even any cases here, we had learned from other hospitals internationally, nationally, in our own company, that there was great risk of spreading the illness within the hospital because of people who were asymptomatic coming in and not wearing a mask. And so one of the first things we did was screening at the doors. Even before we restricted visitation, we screened all visitors for signs and symptoms. And then when PPE allowed, we started to take temperatures and put masks on everyone. And then we went to what we called level 2 visitation. Level 2 visitation restrictions meant that we allowed only 1 visitor per family member at a time, except in certain specific situations. And then when we started to see widespread community transmission in our own community of COVID-19 illness, we went to what we call level 3 visitation. And as you can imagine, level 1 is essentially no restrictions. Level 2 is some moderate restrictions. And level 3 is no visitors at all in the hospital. And we were in level 3 for a number of weeks, if not months, because we were very concerned about people getting infected in the hospital, especially healthcare workers, because they are a limited resource and we wanted to make sure they were available to care for everyone in the community. So we limited visitation to people who had pediatric patients and they needed their parent to be with them, patients who were in labor and they needed a family member to be with them for that wonderful occasion that when someone has a child, and in end-of-life situations. At level 3, we restricted any visitation for any patient with COVID or in any of our COVID units because we don't want to put the patients and their family members at risk for transmission any more than we have to. We recognize completely just how challenging that is for families. It's hard on our staff. We don't like it, but we think in the community's best interest and in order to be safe, it's the right thing to do. So over time, we've monitored this, and while we've still have a lot of numbers of patients in the hospital who have the illness, averaging around 15 to 20 a day, it's been relatively flat. Our supplies of protective equipment have improved. We have a steady supply chain for that. And we have learned how to manage the flow in the hospital to isolate and protect the patients and their family members of those who don't have COVID-like illness from those who do. And so we've recently changed our visitation back down to level 2, meaning that each patient is allowed 1 family member between the hours of 9 a.m. and 8 p.m. They register when they check in, And then we ask that they have very limited mobility throughout the hospital, again, to protect them and protect other people. And it still, however, importantly, does not include the COVID positive units, and that's a challenge for us.
So who would be allowed on the COVID unit?
So almost no one. There are circumstances, very select circumstances, that we make exceptions, and that typically involves some end-of-life situations, but not all, and some circumstances where patients are, for example, if we had a pediatric patient with COVID illness, we would make an exception in that circumstance.
And explain level 2 visitation as far as one person. That's got to be the same person, so family members can't rotate in and out being that one person. It's one person per day.
Yes, and what we would prefer is that it be the same person throughout the entire course of the hospitalization. We recognize sometimes that's not always possible with work and other kinds of situations, but we do limit it to one person per day so that we can monitor the flow of patients in our institution, or of family members in our institution to see our patients. And what we have what we have discouraged and tried to prevent together is moving throughout the building. No ability to come and go and come and go, because that just increases risk. The more mobility in the community, the more mobility in our hospital, the higher the likelihood we could have inadvertent transmission of the virus.
And I know, having talked to staff and others, that there's a great deal of empathy for people who can't come in and see their loved ones who are ill. I know that it's heartbreaking for our staff, but I do know that we've put some things in place with iPads and such to help people still remain in some communication.
Right. It sort of goes back. I remember that when we talked about social distancing, what we really mean is physical distancing, and that's been hard on people. The same thing applies in the hospital. While we don't want a lot of visitation, we still want people to have connections with their families. We recognize how important it is to be surrounded by your loved ones when you're ill for emotional purposes, and we know how that improves your ability to recover. There's good studies that show that. Balancing that against the risk of transmitting the virus has been tough. And so we've tried to use virtual technologies to facilitate communication. You know, old-fashioned telephone works, but it's not ideal. Most people have smartphones these days, and so there's unlimited ability to call your friends and family on that. We don't restrict that at all. And then for those who don't have that technology, we have a supply of iPads available and are more than happy to facilitate as best we can communication with family members as much as we can, while still being able to do the important care measures that are needed to get people better, whether they have COVID or another non-COVID type illness.
I heard a story that our CEO at Mission Hospital, Chad Patrick, took his own phone out of his pocket to help somebody communicate with their family. So I know that staff are feeling a little overwhelmed, challenged, but also very empathetic to what the community is dealing with, especially if they have someone in the hospital. So we're doing our best to help, right?
That's exactly right. We're doing it right from the people who are, you know, at the bedside day to day interacting with the patients to the CEO of the hospital, as you pointed out. We don't like it, but we find it to be necessary and in everyone's best interest, and we ask your cooperation for everyone's safety so that we can get through this as quickly as possible and get to whatever our new normal is going to be.
So we're coming up on our 4th of July weekend. What advice do you have for those who may be anticipating that they might gather?
Yeah, it's a hard thing. We certainly have seen gatherings occur. I want to remind people that in the states that have opened up, particularly where they've opened up social venues like restaurants and bars, that is where we have seen the most substantial rise in the number of cases. And in those states, they are pushing, particularly, for example, we get very detailed data from our Gulf Coast market in the Houston, Texas area, and our ICU capacity is being challenged and our beds are being challenged. And we've had multiple-fold increase in the number of patients being hospitalized. It's not just patients in the outpatient setting. There are sick patients who are being hospitalized. And so learning from that experience about what happens when we get in bar settings or concerts or go to beaches, let's use common sense. Don't put yourself in a high-density situation. And if you find yourself where you're with other people, limit the total number of people that you're with. Wear a mask, stay at least 6 feet apart. 6 feet is, you know, frankly, a random, like we are. 6 feet is a random number that we picked, and while We think that the droplet spread of this virus diminishes after 6 feet. We've seen lots of studies which show that 6 feet is not, there's not a wall at 6 feet. There's not an imaginary piece of plexiglass that's preventing us from spreading it. And so anything that increases your likelihood of spreading, screaming, shouting, singing, those kinds of activities, exercising close to someone, minimize those, don't do it, and minimize the number of people you're around. The fewer people you're around, the less likely you are either to transmit the virus or receive the virus from that person accidentally.
So I guess in sort of our closing theme that we always have, that we advise for everybody so that we all continue to maintain our safety. And also, some thanks to this community, because we really have flattened the curve around here. And I think that the community really has been on board and been helpful, and we're grateful for that, because we don't want to be challenged at our hospital.
Yeah, I mean, I can't say it often enough how thankful we are that people have been adherent to the social distancing. I will say that as I drive around the community, they're not as adherent as I would like personally. I think everybody should be in a mask. That's critically important. We wear our masks when we're in situations other than this, where we're so close to each other that we can't prevent the spread. So yes, thanks to the community. Keep doing it and keep wearing those masks. Stay 6 feet at least apart from each other. Wash your hands as often as you possibly can. That's critically important. We have not, I've said this before and I'll say it again, we have not created widespread immunity in the community. Until we have, it's not safe to not follow these practices. And so it's important that we do that.
And also, I guess we can repeat our message to people who are suffering from other types of illnesses, to be sure that they feel safe and know that you can come to the hospital. It's safer to come to the hospital than it is to ignore your illnesses.
Yeah, again, I'll echo that. We've said that before and we'll say it again. The hospital is a safe place. We're doing the best we can to minimize anyone's likelihood of contracting the virus by coming to get their medical care. And we think that delaying medical care is more detrimental or more risky than getting the care than getting the virus in our hospital. If we allow a widespread resurgence of the virus in our community, we will have to seriously consider whether we have the capacity to continue to provide what we call the non-COVID or non-essential services. We don't want to go back there. We don't want to be in a situation where people who need hip replacements or other surgeries that, while critically important, may not be life-threatening. We want to be able to continue to deliver those as we have over the last month plus. But if it takes off in the community again, which it has every opportunity to do so if we aren't careful, then we will find ourselves having to backtrack there, and nobody wants that. That's not good for anybody.
Thank you, Dr. Hathaway, for all that information for the community. I want to let the community know that in addition to the things that you may have learned about today, if you have other COVID questions, we do have a COVID-19 page on our missionhealth.org website. If you go to missionhealth.org, at the top is a red bar that says COVID-19. Just click on it. It'll take you to our COVID page. A new addition to that page is a hotline for people who may have lost their insurance during this pandemic. If you have questions about your insurance or how you can regain coverage, look to that page and that hotline for some help.